Do you understand the difference between type 1 and type 2 diabetes, or does it kind of confuse you? I'm Donna, the Dynamic Diabetic, and today I want to do part one of a two-part uh, video about the differences of type 1 diabetes and type 2 diabetes and things you need to know about them. So I was surprised to find that there are people who are diabetic who know they're diabetic, but they don't know what type. So this is what has driven me to think that maybe we should cover this. So, differences between type 1 and type 2. Type 1 diabetes is caused when your pancreas no longer produces insulin. It just doesn't produce it. Type 2, your body doesn't respond to the insulin your pancreas produces, or your pancreas does not produce enough. 90 to 95% of diabetics are type 2. And that's good because type 1 has a rough time. It often affects children, adolescents, and now even some late onset with adults. And again, the pancreas no longer produces insulin. There's no way to prevent it. And it's thought it may have some reference to heredity, but they're not real sure. Type 2 diabetes mostly happens as we age, although kids can get type 2 as well. And again, your pancreas produces insulin, but your body can't handle it. It doesn't know what to do with it, can't get it in the cells correctly to give you some energy. And it's believed that lifestyle and diet can play a part in that. There are 30 million diabetics in the world today, and 25% of them don't even know they have it. It's really sad. So in both type 1 and type 2, they're affected by insulin or lack of insulin. Insulin is a hormone. The pancreas produces the insulin, and the insulin regulates how our blood sugar becomes energy. So when we don't have it, that's not very good. So a type 1, okay, that comes on pretty fast. If you're a type 1, it will happen pretty fast. You'll get some symptoms. And unfortunately, because your pancreas is not producing insulin, then you will have to take supplemental insulin from day one and for the rest of your life, or until they come up with something better. Risk factors for type 1 would be, again, perhaps a family history of diabetes, birth genetic defects, or abnormalities that affect your insulin production, medical conditions that you might have to develop, like cystic fibrosis, hemochromatosis, had to look at that one, possibly even some childhood diseases that we have, like mumps, measles, and rubella, cytomegaloviruses. There are things there that can lead or suggest type 1 diabetes. Type 2, on the other hand, your body just starts to resist insulin, and you may not have to have insulin right away, but maybe over time as the disease progresses, you would have to take some additional insulin. This is called insulin resistance. So if you hear that term, that's what it's referring to, a type 2. And this usually develops over time. You know, when you have high blood glucose, symptoms may take years to actually show up enough for you to have it checked if your doctor isn't checking on a consistent basis. And people use medication, diet, and exercise all together to help reduce the effects of this disease. We don't have to use the insulin again right away, but we might have to use it down the road. Our risk factors are a little bit bigger. They are, again, family members that have a history of diabetes, your mom, your dad, your grandma, your Uncle Fred, any of those that have diabetes put you at risk. If you're overweight, if you're obese, you are more at risk. If you're a smoker, you're definitely more at risk. If you eat an unhealthy diet, if you don't get exercise, and even some medications are believed to help contribute to this. Another sad factor is ethnicity. So if you're black, if you're Hispanic, if you're a Native American, if you're an Alaskan, if you're a Pacific Islander, if you're an Asian, your risks are all higher. Both type 1 and type 2 have a genetic risk factor and environmental risk factor, what's going on around you. And curiously, they found that both tend to suffer from low levels of vitamin D, sunshine vitamin. And they've discovered that breastfeeding an infant, even for a short period of time, may prevent them from developing type 1. I'm going to give you a few of the symptoms of those two, and then my next video will talk more about other things. Type 1, before diagnosis, your BMI is really good. You're in great health. You feel good. For type 2, your BMI is usually high, and that's your body mass index, how much fat you got on you, right? It's usually high, over 25. At the onset of the disease that you would notice, it only took just a very few weeks. That's all it takes. And for type 2, it develops over years. So quite different in how they come on. But their symptoms are somewhat similar, okay? An increase in thirst, an increase in urination, an increase in hunger, blurry vision, numbness or tingling in your hands or your feet, tiredness, fatigue, especially type 1, major fatigue, sores or wounds that just don't seem to want to heal, and unexplained weight loss. So if you're looking at any of those symptoms and you think, wow, maybe I should get checked, well, you're right. Maybe you should get checked. Your doctor can do a simple test when you go in for a checkup and determine where your sugar has been and go from there. So that's type 1 and type 2's, a little bit of similarity, a little bit of differences, and we'll cover more in my next video. This is Donna Denson, the Dynamic Diabetic, hoping to find you well and safe today and wishing you all the best. Thank you for being here. May God bless and keep you until we connect again. Bye-bye.